Hello, I'm Dr. Bruce Wolkoff, a cardiologist at Cleveland Clinic's Heart and Vascular Institute. Today, I would like to talk to you about sudden cardiac arrest and sudden cardiac death. Most people do not realize that sudden, unexpected death caused by a loss of heart function is the largest cause of natural death in the United States. About 250,000 adults die from sudden cardiac death in the United States each year. More than AIDS, breast cancer, lung cancer, or stroke added together. Sudden cardiac arrest is not a heart attack or myocardial infarction. It occurs when the electrical system to the heart suddenly produces a very irregular heart rhythm. The heart beats dangerously fast. The ventricles may flutter or quiver, and blood is not delivered to the body. In the first few minutes, the great concern is that the blood flow to the brain will be reduced so drastically that a person loses consciousness. Death follows unless emergency treatment is begun immediately. Sudden cardiac arrest should not be confused with a heart attack. Heart attacks occur when blockage in the coronary arteries prevents the heart from receiving enough oxygen-rich blood and the heart is damaged. However, sometimes patients who are having a heart attack will progress to a cardiac arrest. Emergency treatments can include cardiopulmonary resuscitation, CPR, to keep oxygen in the lungs and brain, and restoring the normal heart rhythm by shocking it with a defibrillator machine, an AED. Sudden cardiac arrest can be treated and reversed, but emergency action must take place immediately. Survival can be as high as 90% if treatment is initiated within the first minutes. The rate decreases by about 10% each minute longer it takes to initiate therapy. Those who survive have a good long-term outlook. Most sudden cardiac deaths are caused by abnormal heart rhythms called arrhythmias. The most common life-threatening arrhythmia is ventricular fibrillation, which is an erratic, disorganized firing of impulses from the heart's lower chambers. When this occurs, the heart is unable to pump blood and death can occur within minutes. If you have had a heart attack, have coronary artery disease, or heart failure, ask your doctor about your risk of sudden cardiac arrest. Reducing blood pressure and cholesterol levels, quitting smoking, and managing weight are often recommended. You should also know your ejection fraction. This tells how well your heart pumps blood. If your ejection fraction is 35% or less, you may also be at risk for sudden cardiac death. Your doctor will likely prescribe medications, but also may suggest you have a pacemaker or defibrillator device surgically implanted under your skin to monitor and rescue your heart. Implanted cardiac devices use electronic pulses to help the heart to beat regularly or to jolt it back to normal when the beat gets out of control. The good news about sudden cardiac arrest is that survival rates can be as high as 90% if treatment is given within the first few minutes. If you are at risk, teaching your friends and family to be alerted for symptoms and to call 911 right away, and encouraging them to learn how to perform CPR and use an AED device can save your life. Your doctor will explain all the options available to you and work with you to decide on a treatment plan that is best for you. Thank you.